Hello viewers, I am Dr. Jasmeet Kaur Wadhwa. I am a pediatric pulmonologist, allergist, bronchoscopist. I am heading this Center of Asthma Allergy TB Chest and Child Center at Janakpuri. We are treating patients at all age groups and those having recurrent and repeated coughings, breathing difficulty, respiratory problems, chest pain. Even children come to us with the problem of wheezing, noisy breathing, and maybe they are not even sure if the child is having asthma or not. Even the adults, they come, they have some form of allergies which causes chest problem and discomfort. What happens actually that this is a part of a lung and this is a bigger airways. So whatever the allergy comes to the nose, it goes and deposits it over here. And there's a lot of inflammations and problems which coming. This is causing coughing and chest pain and breathing difficulty. So because of this, patients are, most of the time we have to diagnose them that are they having asthma or not. We perform a very good lung function test over here at our center, and that actually diagnose the problem of allergies inside the lungs. That means how much is the problem inside the lungs, how much is the lung functioning, how much we are able to take out our breath. According to that, many patients are treated either by our nebulizers or by the puff. From my end, and basically with what we follow all over India and at All India Institute of Medical Sciences and all over UK and US, that if we want to treat asthma or bronchitis as in a layman term, we should use spacers. These are the spacers and the puff. First of all, there are so many myths attached to the puff and the spacer that you get habitual of it or they destroy the lung. But no, these are the devices of giving the medication till the airways. So most often you have to be you have to be diagnosed, are you having asthma or not, by a lung function test. And if you are having it, even with the nebulizers, because nebulizers can be given only for a short time, best is to how to take a spacer and a puff, because this is the best medicine and the way of giving medication. In our subsequent videos is how to take a spacer and a puff we have already shown, but most important is to diagnose it properly and how to give the medicine via a spacer and a mask. Or in children we generally use mask and the spacer, but in adults we use only spacer. So this is the way we treat asthma at our center. We also treat recurrent pneumonia. We also do allergy skin testing, like how much the patient is exposed to the allergens. Is it exposed to dust mite or many other fungal allergies or pollination? Even they get diagnosed over here by doing a proper skin prick test or allergy test. This is the gold standard test which is done again in very specialized center in India, and very few doctors are doing it in Delhi, and it is mostly done at UK, US and Pathology and AIIMS. But this is the gold standard. The mostly allergy testing done via a blood test are sometimes come falsely negative and falsely positive, but doing a skin prick test, which on the skin itself we put the allergens by drop and we touch it and then we wipe it, and after 15 to 20 minutes we see that what allergen they are sensitized to. So this is a big list we have of the allergens which is showing the allergy testing. So these are like few dust mites and pollinations we test of the patient with some 20 allergens of aero allergens, and these are with the food allergens, and this is the way, these are the all scientifically proven allergens. And at our center we also go for an immunotherapy shot. So these are the two performers what we actually test for the patient. They are tested on the skin. Those having allergic, those having high IgE levels, we test these botanical names allergens on the skin itself, and in 10 minutes we get the result that with which allergen they are sensitized to, either the dust mite, pollens, fungal or main food allergens. So this is the way we diagnose them, the asthma, and we cure their allergies by doing a skin prick test and a very good comprehensive checkup at our center. Thank you.